Members, if you don't mind, please signing in. And Mr. Clerk, please open the vote for roll call. All those present, sign in for us. All members registered, I think so. There you go. Mr. Clerk, please take the roll.
Mr. Chairman, you have 9 members present. You have a quorum.
Fantastic. It is a little after 12 o'clock on Wednesday. It is House Health Subcommittee. So I want to welcome all you in the audience today. I do know we have a special group with the March of Dimes. Are you guys in the building today? I want to welcome you guys here. Thank you all for being here. Any other personal orders from the committee? I've got a personal one. Watching at home today are my family, Steele, and all the Huntington Phillies are watching. They're in the state tournament playing at 12:45. So give a shout out to the Huntington Phillies. Hopefully they'll win today. And Steele and family watching. So let's get rolling with item number 1, House Bill 1905 by Chairman Terry. You are recognized. I'll get a motion in a second. You are recognized. I believe you have an amendment, sir.
Yes, thank you. Drafting code 014088.
That is it. Need a motion and a second on it?
Second.
Motion second, probably for us. All those in favor say aye. Aye. No
Aye.
opposed? Ayes have it. You were properly before us, sir.
All right. Thank you, Chairman and Committee. What this bill does, it's the Tennessee Nursing Education Integrity and Oversight Act. It addresses an important issue affecting healthcare quality and patient safety in our state. This legislation was brought to me by the Nurses Association as they have seen a growing number of out-of-state nursing programs placing students in Tennessee clinical sites which appear to not have sufficient oversight or standardized reporting or clear accountability mechanisms. And so in order to ensure that our clinical sites are accepting quality students meeting Tennessee standards, this legislation is establishing a 2-year moratorium on the new approvals of out-of-state nursing programs seeking to operate or place students in Tennessee during that time. The Tennessee Center for Nursing Advancement and the Board of Nursing will develop improved standards, reporting requirements, and oversight mechanisms. The existing approved programs are not paused, but they would be subject to the data reporting. So the goal is not to limit workforce growth. The goal is to ensure quality, transparency, and patient safety.
Thank you, Chairman. Any questions for the sponsor? Representative McKenzie, you're recognized.
Thank you, Mr. Just a quick question. While I definitely see the impetus of the bill. Maybe I ask you this: what sets the anesthesia nursing programs apart from the other ones, and they shouldn't be part of this moratorium?
Chairman Terry.
Thank you. So great question. And so in order for them to get into a program, they have to go through ICU training. And so they've got a year of that. So they're highly supervised in that area. So they're going to have that standard that goes through there. So that training sets them apart.
Thank you.
Chairman Hill, you're recognized.
Thank you, Chairman. And a question for the sponsor: the moratorium, as stated in the legislation, could you just clarify what that moratorium attaches, or what that really means?
Chairman.
Thank you. And what that's doing is it's essentially allowing the Board of Nursing to get that, to collect the data and to get the standards put in there so that we have a limited number of clinical sites. We don't just have an unlimited amount of clinical sites. And so we want to ensure that the students that are going in there are safe and that they have met the standards for our patients here in the state. And so that's what they're trying to work is through that time limit process.
Thanks, Chairman.
Any further questions for the sponsor? Not seeing any. Mr. Clerk, please open the vote. All those in favor of House Bill 1905, vote aye. Those opposed, no. Mr. Clerk, please take the vote.
Mr. Chairman, you have 7 ayes and 1 nay.
The ayes have it. House Bill 1905 moves on to health full. Brings us to item number 2, Chairman Terry as well. And a motion and a second, and I believe you have amendment, sir.
Yes, drafting code 013970.
That is correct. Motion second. All those in favor say aye.
Aye.
Opposed? Ayes have it. Your bill is properly before us.
All right, thank you, Chairman and Committee. And so what we're trying to do here, this directs Department of Health to develop a statewide healthcare data platform specifically for implantable medical device information. So as a physician, we can see firsthand the challenges that we face when patients come in and we cannot easily access or communicate with their critical devices like pacemakers or implantable defibrillators. And so particularly in emergencies. And so what we're doing is trying to set up a voluntary registry where that information can go to the Department of Health. And so I'll give you an example. For me as a physician, our surgery center that we may have somebody that comes in at 6 a.m. in the morning, and they may have their card, they may not have their card, that they have a defibrillator or whatever. And so I may end up calling over to the hospital and trying to get information, and they may not have ever been in our hospital, and they may be at Vanderbilt or somewhere else. And so this is setting it where they can have like a QR code or something on their phone. And so I could scan that, I could get their device, but it's all voluntary for them. So that's what the bill does.
Thank you, Mr. Chairman. Any questions for the chairman? Not seeing any. Mr. Clerk, please open the vote. All those in favor of House Bill 1936, vote aye. Those opposed, vote no. All members voted and remember wish to change their vote. Not seeing any. Mr. Clerk, take the vote.
Mr. Chairman, you have 8 ayes and 0 nays.
The ayes have it. House Bill 1936 moves on to health full.
Thank you, Chairman and Committee.
We're going to slightly go out of order just for a moment and go to House Bill 1957. Motion and second. You're properly before us, ma'am.
Chairman, and thank you, committee. I'm going to take this bill off the notice, so I'll just tell you that up front. But the reason I'm going to take it off notice is I want to do what's right by the citizens of this state. This is a good bill in that we need to protect the deaf children in this state. We also need to give deaf children the opportunity to be able to have language and to be able to, when they walk into the door of a school when they're 6 years old, not to be sent to special needs just because they can't speak. We don't know how many deaf children we have in this state. We have no idea. We don't know if their parents have all the tools that they need. We don't know that. But what I want to do is work with the Department of Ed, the Department of Disabilities, Department of Health, which we've already worked with before, but we really want to come to the table and make some decisions. The governor flagged this bill not because there was something wrong with the bill, but because it set up another commission. So that's the only reason we're taking it off notice, because if we can get this into the right posture and get the right people into one of these departments to research this information and help us so that we can help deaf children in this state. So
Thank you, madam. Any questions for the sponsor? Representative McKenzie.
Thank you, Mr. Chair, and thank you for bringing this bill. As you know, I signed off on it. Continue to work with the department, but it's important enough to where even if it takes a department and they have X too many apartments, to me, this eliminate another department or another commission.
Right.
Let's make sure that we're working with and honoring and understanding our deaf community in a bigger way than we are today. So again, thank you for bringing this bill. Please don't be discouraged with where we are, what the posture is now, and please bring it back next year. Thank you.
Thank you, ma'am.
Thank you all.
Without
committee.
further questions, House Bill 1957 is off notice. Thank you,
very
ma'am.
much.
I'm going to pass the gavel down to Chairman Terry.
All right, thank you. That brings us to item number 3, House Bill 1770 by Chairman Martin. We have a motion and a second. And which amendment are we going to be?
Yes, sir. We have
Okay.
014388.
Okay, motion and a second on amendment 014388. All those in favor say aye. Opposed, ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Chairman and Committee. This bill as amended makes five important changes to the Tennessee Code. First, it formally recognizes 3 emerging medical specialties within the practice of medicine and osteopathic medicine. Second, it clarifies that all doctors, regardless of medical specialty, should follow generally accepted criteria for medical necessity determination. It clarifies that all medical providers are subject to disciplinary action by the Board of Medicine if they do not use proper standard of care when making medical necessity determinations. It exempts TennCare's clerical administrative decision-making by their doctors and the TennCare appeals process by consumers. It clarifies no scope of practice changes for other healthcare providers. And with that, I stand ready for question.
Any questions for the sponsor of the bill? Seeing none, we open the vote. All those in favor vote aye. All those opposed vote no. Please take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
House Bill 1770 passes and moves on to full as amended.
Thank
Full
you,
health
Committee and
as
Chair.
amended.
Go back through some quick, that's right. So quick changes here. House Bill 2049 is officially off notice. No, item number 5, House Bill 2307 is off notice. House Bill 2347, item number 16 on the calendar is off notice. House Bill 1688, item number 21 on your calendar is off notice. Item number 9, House Bill 2090 is rolled to the heel. House Bill 2259, number 13 on your calendar is rolled to the heel. Number 17, House Bill 2413 rolled to the heel. House Bill 1887, number 19 on your calendar to the heel. House Bill 1160, number 22 on the calendar is also to the heel. House Bill 1853, number 24 on the calendar is rolled to the heel. House Bill 2415, number 33 on the calendar is also rolled to the heel. About all the bills are at the heel, so we're almost back to the heel again, but we'll keep moving to item number 6, which will be House Bill 1950 by Ms. Chairlady Rudder. Motion and second, no amendments. Ma'am, you are properly recognized.
Thank you, Mr. Chairman. This bill allows for the qualified speech language pathologists to work before their Tennessee license is officially issued, reducing wait times for patient care. To practice during this period, it would be necessary for the examinations must have been passed. The legislation would remove the requirement for SLPs that would remove the requirement that SLPs must be members of the American Speech Language Hearing Association to acquire their state license. If passed, the state board cannot force applicants to hold an SHA certificate as a condition for obtaining licensure. Why this matters? Easier hiring. By letting qualified professionals work while their paperwork is pending, schools, hospitals can fill critical therapy roles more quickly and lower personal costs. It would prevent the state from requiring professionals to pay for private national certifications if they already meet the state's education and testing standards. And with that, I stand ready for question.
Thank you, Madam Chair. Any questions for the sponsor? Not seeing any. Mr. Clerk, please open the vote. All those in favor of House Bill 1950, press aye. All those opposed, no. All members voted. Any member wish to change their vote? Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 1950 moves on to health full.
Thank you, Mr. Chairman and committee.
This brings us up to item number 7, House Bill 2572 by Chairman Kumar. He is here. Motion and second. Chairman, I believe you have a amendment with the bill.
Amendment 015170.
All right, we'll get that on motion. Second on that. Any question on the amendment? Not seeing any. All in favor of the amendment, say aye. Aye. Opposed, no. The ayes have it. You are properly before us, sir.
Thank you, Mr. Chairman and committee members. We've had a long-standing curse in our state called opioids. Prior to the initiation of comprehensive pain management clinic regulation in 2011 and a review in 2017, there were 350 pain clinics, so-called pill mills. Now they are reduced to 114. With pain clinic regulation, clinics were tightly controlled, of course, but we were not controlled the supply on the street. So the curse still continues with fentanyl overdoses. House Bill 2572 reforms pain clinic management and licensure laws. It authorizes the Department of Health to determine criteria to identify high-risk prescribers. Those are prescribers who give too much medication and whose patients have too many overdoses. High-risk prescribers are subject to chart review and investigation, and the criteria for being selected as a high-risk prescriber will be published on the department's website. Also, to ease the work of those specialists who are performing a needed service, expungement of prescriber record after having been a high-risk prescriber will be allowed after 2 years and after they have completed additional continuing medical education. It also allows for better clinic work by relaxed requirements that pain management clinics can substitute short-term relief by other specialists, and they don't have to report transient changes within the clinic. And it adds a feature that when in doubt, a pain management specialist can ask for a private ruling, just like an IRS private ruling from the Department of Health that would advise them about the right course to take. With that, I'm ready to explain any further.
Thank you, Chairman. Any questions for the chairman? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 2572 by Chairman Kumar, press aye. Opposed, no. All members voted. Any members wish to change their vote? Not seeing any. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 2572 moves on to Health Full. And while you're here, we might go on to your next one, if you don't mind, Chairman. House Bill 2571. Got a motion and a second. It's item number 46 on the calendar. I can get to it. There we go. No amendment, so you are properly before us, sir.
Thank you, Mr. Chairman. Thank you for taking this up. I think somebody was trying to do me a favor, and instead of putting it on the subcommittee calendar, it got placed on the full committee calendar directly. So, but we are back where
Such
we
a
belong.
good bill. They moved it on quicker, so there you go.
Right. House Bill 2025 addresses the problem of physician shortage in the United States as well as in Tennessee. While the United States needs more than 100,000 additional physicians, state of Tennessee needs at least 18,000. House Bill 2571 provides an easier pathway to enter medical practice for U.S. citizens who have gone to medical school abroad, as well as international medical graduates. The legislation allows that a person who has a medical degree, 3 years of work experience or postgrad training, has passed their ECFMG and USMLE exams, can apply for employment at a medical center and with an approved residency program. And they can, if they get a job offer, they can, of course, apply for an H-1B visa. After satisfactory completion during those 2 years, they can get an unrestricted license to practice medicine in the state of Tennessee. We were among the first in the country to pass that law. However, Other states such as Alabama, Florida, and Texas have allowed training to take place even outside the medical center. And that's what we are doing now. We are adding those possibilities so the graduates can train outside the medical center also. Those outside venues include federally qualified health centers, rural health clinics, community health centers, GME approved university programs, and a specialty a clinic under the direction of a board certified physician. That allows for additional venues where these people can train and get their license. With that, I'll be happy to explain your questions.
Thank you, Mr. Chairman. Any questions for the sponsor? Not seeing any. Mr. Clerk, please take the vote. All those in favor of House Bill 2571, press aye. All those opposed, no. Mr. Clerk, please take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 2571 moves on to health full.
Thank you, Mr. Chairman and committee.
Item number 23, House Bill 658, been rolled to the heel. And that brings us back up to item number 8, House Bill 2092 by Chairman Powers.
Thank you, Mr. Chairman and
We get a
committee.
motion and second. Motion and second. All right, sir, you are back before us.
Thank you. House Bill 2092 requires the Department of Health to create an outreach program of CMT in this state. CMT is Charcot-Marie-Tooth disease. It's a group of inherited conditions generally passed down through families that cause peripheral nerve damage. It's estimated that 1 in 2,500 now have CMT, including celebrities like Alan Jackson and myself. Did anybody get that, Joe? Okay. We really have no way of knowing how many Tennesseans are afflicted by it because no data has been collected yet. House Bill 2092 requires the department to establish and promote toll-free telephone or web-based hotline for a person to report this diagnosis or to donate to the research of CMT. This is a one-year non-recurring campaign. And with that, Mr. Chairman, I have someone here testify on the bill.
Thank you, Mr. Chairman, and I do like you better than Alan Jackson, so you work. Without objection, we'll go out of session. And would Ms. Kissy Black please come forward? Ma'am, if you don't mind introducing yourself to the committee, stating your name and whom you're with, and then you'll have 3 minutes.
Thank you. My name is Kissy Black. Chairman, members of the committee, thank you for having me here today. I am a patient advocate on behalf of Charcot-Marie-Tooth disease and a resident of Tennessee. Charcot-Marie-Tooth disease does not announce itself. It arrives quietly in a child's stumble, a teenager's weakening grip, a parent's gradual loss of feeling in their hands and feet. It moves through families like a shadow that no one has been given the language to name. And because it has no name in so many households, it causes no alarm, only accumulating loss. CMT is the most common inherited neuromuscular disorder in the world. It is progressive and it is hereditary, which means that when one person goes undiagnosed, an entire family line goes unprotected. Parents pass it to children without knowing. Siblings watch each other decline and call it fate. Grandparents see themselves reflected in their grandchildren's struggles and assume it is simply the way their family is built. This is not fate. This is a disease, and in Tennessee, we're allowing it to go unnamed in the majority of approximately 2,800 people who carry it, and that number could be 30% higher because of the way this disease goes unannounced and undiagnosed. The burden of CMT on families is profound and compounding. Mobility loss, chronic pain, progressive disability drive medical costs, loss of employment, and dependency that ripples across households and generations. Caregiving falls on spouses, on children, on aging parents, people who are frequently managing their own undiagnosed symptoms of the same disease. The weight is carried in silence because the condition has never been identified, and what has never been identified cannot be treated, accommodated, or supported. So point 1 in support of HB 2092 is that this bill counts patients, and counting patients is how you serve them. That will give them care coordination, clinical trial access, and pathways to therapies in active development right now. Another interesting side note about this HB 2092 is that it could connect Tennessee to proven data infrastructure. In 2005, Senator Marsha Blackburn, at the time during her tenure as a U.S. representative, was among the elected officials whose support helped bring the critical path Institute into existence, and Tennessee would not need to build a new federal relationship from nothing. It already has a standing relationship within an institution it helped create. And HB 2092 is a spark, not a ceiling. This partnership and community outreach campaign led by artist and advocate Linda Davis, who has this family disease in her family line, together creates the synergy and the real authenticity needed to carry this initiative forward, which would allow federal grants, Center of Excellence designations, pharmaceutical research partnerships, and all of which require a patient data foundation. HB 2092 builds that foundation, and the return is designed to exceed what Tennessee commits today. Every generation of a CMT family that goes undiagnosed is another generation lost to preventable decline. HB 2092 is how that cycle ends, and I thank you for hearing my testimony today.
Thank you, ma'am, for coming and testifying before us. Any questions for the ma'am? Not seeing any. Thank you very much for testifying, for being here. Without objection, we'll go back into session. For the members, any question for the sponsor? I'm not seeing any. So, Mr. Clerk, open the vote. House Bill 2092. All those in favor say aye or press aye. All those opposed, no. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 2092 moves on to health full.
Thank you, Mr.
Congratulations.
Chairman, committee.
And right on time, item number 10 is House Bill 1495 by Chairman Slater. Got a motion, second. No amendments. You were properly before us, sir.
Thank you, Mr. Chairman and committee. Current law contains a limited exemption from licensure for respite care service programs who are operated by a religious institution or organization. To qualify for this exemption, the program is required to register with the Department of Human Services and keep records of the dates and times of each adult's attendance. This legislation makes a modest adjustment to the current respite exemption by increasing the allowable number of patients from 15 to 20 and increasing the allowable weekly service hours from 12 to 16, meeting rising demand. And with that explanation, I stand ready for questions.
Thank you, Mr. Chairman. We do have an individual liking to speak on this bill, so without objection from the committee, we'll go out of session and bring up Mr. William Zagorski. Close. If you don't mind, come on up. State your name and your association, sir, and you'll have 3 minutes.
Thank you, Mr. Chairman, members of the committee. My name is Bill Zagorski. I'm the Executive Director of Centennial Adult Care Centers, a state-licensed adult day services organization founded by my parents here in Nashville in 1991. I'm speaking today on behalf of the Tennessee Association of Adult Day Services, or TADS, which I have the honor of serving as the president since 2015. I appreciate the opportunity to share our concerns regarding House Bill 1495. TADS represents the growing adult day services sector across Tennessee, including more than 40 programs licensed through the Department of Human Services, as well as the majority of the current licensed and registered and licensed exempt respite programs. These programs all serve vulnerable adults and provide essential supports to caregivers throughout our state. Let me begin by please stating clearly that TAD strongly supports respite services and supports the congregations that support or provide these services. Respite care is an essential lifeline for family caregivers and an important support for individuals who need assistance during the day. In fact, adult day services themselves are recognized as a form of formal respite under Tennessee law. We also supported the creation of the existing respite exemption that allows congregations to provide limited services without full licensure. Today, 6 programs operate successfully under that exemption and provide excellent care to the people they serve. You may hear from other programs supporting this legislation, and our opposition in no way detracts or undermines the quality services they currently provide. However, House Bill 1495 significantly expands that exemption, not just for existing organizations, but more importantly for new and unproven organizations in ways that remove basic safeguards that protect vulnerable adults. Under the proposed legislations, programs can now serve up to 20 individuals without requirements that exist in licensed programs, including criminal background checks or abuse registry checks for staff and volunteers, no staff or volunteer training or competency standards, no minimum staff or volunteer to participant ratios, no basic health and safety requirements or meaningful record keeping or any form of oversight or inspections. Just last week, the committee unanimously rejected House Bill 2088, which would have allowed private duty nursing services to be provided to 4 or few individuals without licensure or oversight from the Tennessee Department of Health. Yet this bill would allow up to 20 vulnerable adults to be served at one time with no training requirements, staffing standards, or oversight from the Tennessee Department of Human Services. We believe these bills raise a similar concern, expanding access to an important service in ways that unintentionally remove the protections that vulnerable adults and their caregivers depend on. Faith-based organizations are uniquely positioned to provide respite services, and importantly, they already have a pathway to do so under the current respite exemption, and the licensing process through Department of Human Services is straightforward and costs only $200 per year, while ensuring background checks, appropriate staffing, and basic safety standards. Well intentions alone cannot guarantee safe outcomes. Good people can make mistakes. Even well-meaning programs benefit from clear standards that protect participants, caregivers, and the organizations themselves. TAD stands ready to work with congregations, providers, and lawmakers in the Tennessee Department of Health and Human Services to expand respite services responsibly. And we respectfully ask that this committee reject House Bill 1495 as written and allow us to continue to grow these services within a framework that protects the vulnerable adults and their caregivers we all combined serve. Thank you for your time.
Thank you, sir. Any questions for the individual? Representative Gant, you're recognized.
Thank you, Mr. Chairman. Thank you for being here today and providing testimony. Do exempt respite organizations have to provide any type of staff or volunteer training or ratios?
There is no requirement for any type of ratios or training requirements under the exemption. The current existing exempt organizations, by and large, existed before the first exemption took place, so they follow the best practices and standard under Department of Human Services. But new organizations that have recently started, or any new organization that could start in the future, have no minimum requirements of any kind.
Okay. Are there any safety requirements?
None. There are absolutely none. There's no requirements for life safety. There's no requirements for, delayed egress, for fire safety, for CPR, first aid training, for insurance, liability protections. There's no requirements of any kind.
But what about inspections?
There's none. Since they are exempt from the Department of Human Services licensure, there's no inspections, there's no audits. The process for a program to apply is a two-page piece of paper that is self-attested and emailed to the Department of Human Services and stamped and filed.
Wow. Okay. All right. Thank you, Mr. Chairman.
Any further questions for the speaker? Not seeing any. Thank you, sir, for being here.
Thank you.
Without objection, we'll go back in session. Thank you, Chairman.
Thank you, Mr. Chairman. And let me just respond for a minute to what was testified. First of all, there is the ability for state agencies, Department of Human Services to come and to inspect or to visit one of these respite care centers. These are not adult daycare centers. These are respite centers. Let me back up and just describe for you what this looks like. I've had the opportunity to visit the one that's in my district on several occasions. The individuals who come to these respite care centers are individuals who have memory loss type of issues, dementia, and those types of things. The respite is for the caregiver, for their children, perhaps, for a spouse, for another loved one, so that they can have some time to go and to go shopping, maybe go to the movies, take a nap, run some errands. These are respite care centers, and they give respite to the caregivers. Now, we've been very fortunate in our family that we've not been in that situation, but I suspect that there are many in this room and probably some members who your family has cared for someone with Alzheimer's. And you recognize how difficult it is, especially if there's maybe a single caregiver or just a couple of caregivers, or caregivers that are changing their schedule, their work schedule, so that they can make sure that their family member has care. The respite care centers that we're speaking about this morning, they're ministries. They're nonprofits. I would say that there's some analogy perhaps to your place of worship, your church. And your church may have enough room, for example, for, let's take the nursery program. They have enough room for only 10 children. But then if they expand the nursery, they have room for 20 children. And who are we to say as the government that, okay, that these ministries cannot operate and provide this service to the folks in their community? So it was mentioned that there's no oversight, or there was an implication that there's no oversight. Well, everyone, I think, recognizes the fact that if you build a building or if you remodel a building in any way, then there are going to be codes that are going to be followed. It's a public building, so there's going to be capacity that's going to be there. So the implication that there is absolutely no oversight, I think, is grossly exaggerated. This is just a minor adjustment. This is taking from 15 to 20 individuals that can be served. That's 5 more families that can have this respite care. The hours that are added is just because of the additional number of individuals. And so it's a very minor adjustment to this exemption that the General Assembly has already seen as important for the families of our community and for the ministries of our community. With that, I stand ready for questions.
Thank you, Chairman. I think we do. From Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And I heard you say at the beginning of your follow-up to the witness that Department of Human Services can come into the facilities. My question is, as my colleague from West Tennessee asked, is there a requirement that they're seen, that these facilities are seen on an annual, biannual, every 3-year type basis?
You're recognized.
Thank you, Mr. Chairman. What I can speak to is only the legislation that's before us. So any ability for any department or agency to come and to inspect would not be changed in any ways. My understanding in talking to a director of one of the respite care centers is that there is opportunity, but they've not taken up that opportunity to come and to visit the facility.
Representative.
Thank you. And that's the final. That's my concern about this one, is that you know, these are some of the most vulnerable people that out there. They're you know, every bit as vulnerable as, you know, some of our babies in terms of their demise from a mental capacity. And so this isn't something that I would think we should, you know, I'm not saying you're taking it lightly, but I think we need to make sure that we understand fully what these facilities are. And as you know, even though the caregiver may be gone for an hour or two, it doesn't take but a second or two for something really, really bad to happen. So that concerns me. And then, as you say, you know, if a church just uses their existing facilities, there are no inspections unless they're remodeling or adding on. So that doesn't necessarily give me any comfort, because most of the churches are built out and they'll just use this space for, you know, Sunday school on Sunday and Wednesday, and have space available during the day. So, but again, I definitely understand the spirit of the bill, but at this point, this one is it's one that I can't support. Thank you.
Chairman.
Thank you, Mr. Chairman. And what I would say in response to that is the folks that care for these individuals the most are their family members. The family members, they come by, they drop them off, they pick them up. In the case of what I've seen with my own eyes, they come into the facility. Who better to determine the quality of care that these individuals are having, this break that they're having, than the family members who love and care for these individuals the most. Sometimes government is not the answer. In this case, I think that families can determine whether or not the quality of care for their loved one is appropriate. And I would add to this, they're not receiving any medical care while they're there. So this is not medical care that they're receiving.
Chairman Williams, you're recognized.
Yes, Representative Slater. I just had a kind of a follow-up to that. So my grandmother had Alzheimer's. So I completely understand, for 11 years, I completely understand the need for respite. I mean, this body has spent $3 million. We may spend another $3 million in caring for families, really more than the patients, by giving them respite care. When in my full-time job, of which you and I have crossed paths before, I have constructed memory care facilities, and I recognize that those are long-term placement and not respite care. But the ratios of people that are serving those people that are there for care are fixed, meaning you can't exceed a certain number of patients or persons in a memory care. Is there, under this exemption that religious institutions or churches or whatever they may be have, is there any guidance as to the number of people? My fear would be that you'd have 15 to 20 folks, even at the current rate, 15 folks where you only had one or two people caring for them. And that's a little bit of a concern for me, particularly since when it comes to the Health Facilities Commission reviewing existing facilities that they're required to review, they're 18 months behind. So the chances of them walking into a place of which they have no authority to change anything would give me some pause as well. Just wondered if you could speak to the relationship of provider to respite care recipient.
You're recognized, Chairman.
Thank you. And thank you for that question, because that, of course, would be a concern for any reasonable person. Let me point out that in current law, I'm going to back up to a previous question and then move forward to the question that you have. For example, we find respite care, the exemption for respite care in TCA 712402. And here we find that the department is authorized to make site visits to a program in order to ensure compliance with the terms of the exemption permitted under this subsection. So that answers the previous question. I kind of solidifies my response, which was a little bit tepid, but we do find it here in code. I can't, to your question, one of the things that is that the respite care center, these exempt ministries are responsible for, is the reporting the attendance to the department. I don't know. I would suspect, though, that one of the reasons for that is to monitor then how many individuals are at the center. Is it always maximum? I would have to defer back to the fact that the department can step in if there's concerns as it relates to it, to that. And I'd go to my previous comments as well. If someone who you love very dearly is in some way being mistreated, or you feel that they're in an unsafe environment, there is a recourse, and that recourse, of course, is with the department to follow up with that.
Chairman, you're recognized.
Yeah, and unfortunately, we find ourselves legislating to the worst case scenario and not the best case scenario. Unfortunately, we do have citizens who may be caring for family members for an extended period of time, and the respite or the timeout is of great desire for them, such that they may not have their loved one's best interest at heart for wanting to get a break. And it's a very challenging way to care for someone whom you love, who in some cases helped raise you, and yet you're struggling with their care for an extended period of time. And I think sometimes it's not, it wouldn't be unusual to think that the desire or demand to just go get your hair cut or run to the bank outweighs the desire to make sure it's qualified and capable care. And so that's a little bit reason why I have concern, particularly since the ratios aren't clearly defined as the number of people. If you were saying, hey, we've got 3 people serving 15, and we want to go to 4 or 5 people serving 20, then I wouldn't have near the concern as I have not knowing, particularly since they're not being inspected or there's no regulatory authority over them. And I recognize big government is not the solution, but on the other hand it does exist to protect citizens in our communities, and I'm a little bit concerned about that. So thank you.
Chairman, you're recognized.
Thank you, Mr. Chairman, and I'm certainly at the will of the committee. What I would ask the committee to do would be to roll this to the heel and let me get with the department and see if we can work with the department in order to satisfy some of these justified concerns.
Thank you, Chairman. I think there's been great discussion around it, and I believe that is a great idea. Without objection, we will roll to the heel. Thank you, sir.
Thank you.
This brings us up to item number 11, House Bill 1979. Chairman White is here. Motion. Second. Sir, with no amendments, you're properly recognized.
Thank you, Chairman and committee. Bring before you House Bill 1979, which we call the Promising Futures Act. This is a bill that we've worked on for a couple of years, trying to get to a place where we could begin. For the past several years, I've been working on different versions of this legislation. This bill is in response to a challenge we are constantly hearing working families need, but not only frequency, but they can't afford quality early child care. The child care is just not available. If it is there, then 2 points. The child care industry labor shortage, child care compensation isn't competitive with other industries and job opportunities. And so the turnover is high and the labor pool is small. The second point, child care tuition costs many times is like as much as your child going to an in-state college. And so majority of working families cannot afford it, resulting in many young families unable to make ends meet on basic household expenses. The bill basically takes the financial responsibility through thoughtful steps towards solving these two problems by using strategies tested and proven in other states. And what the bill does is, first, it establishes the Promising Futures Fund, supported by dedicated revenues from our vape and our hemp. And this will go before finance to make that determination if that will work out. That will be the dedicated funding. Second, the fund builds on Tennessee's Smart Steps Child Care Payment Assistance Program, which is currently limited to low-income families, but also extended to middle-income working families because child care is expensive. And the last point, the fund supports 2 targeted time-limited programs: a child care workforce scholarship program to support the recruitment and retention of the child care labor force. This strategy used in many states covers child care tuition for parents who opt into the child care industry. So provide the child care for the people working in the program. And number 2, to promote employer voluntary investment in child care from the employees. It's a government and a private business match. And between the private and the government and the input of the family, then you have 3 sources of funding. What I like about this legislation working, we're constantly looking for ways, especially not only to help our workforce through child care, but also we can build upon this as this program gets established over the years, is that we have a shortage of even teachers, where you could use this program to bring people in who are working the program, and we could develop them into our early childhood, pre-K through even 5th grade, a teacher pipeline. Why this matters: it addresses the workforce shortages at their source, supports employers without mandates, helps middle-income working families just above subsidy eligibility, and eliminates benefits cliff. It uses dedicated revenues that we're looking at through the Finance Committee and not the general fund, and builds accountability through data-driven evaluation. So the gist of the program is looking for how do we address our child care shortage in the state, so when more people can go into the workforce.
Thank you, Chairman. Chairman Hill, you're recognized.
Thank you, Mr. Chairman. And just a quick question about the program. Does it implement any new taxes on the items that are in the bill, or is it just using existing taxes that are already there?
What is, and this will be decided as the bill moves through or goes through finance. Right now, from what I understand, we do not have a dedicated tax on vape or hemp products. Now, it'll be up to the leadership in finance as to what I understand that it may be more agreeable to look at the vape products right now, not the hemp. So if that source of funding is there, that will fund this 3-year pilot program.
Thank you.
Committee, we do have somebody here to speak if need be. Anybody requests? Not seeing any. Thank you, Chairman. Any questions for the sponsor additional? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1979, press aye. All those opposed, no. Have all members voted? Any members wish to change their vote? Mr. Clerk, take the vote.
Mr. Chairman, you have 6 ayes, 0 nays, and 1 present not voting.
The ayes have it. House Bill 1979 moves on to Health 4.
Thank you, committee.
Item number 122553 rolled to the hill. House Bill number 2459, Chairman Faison is in the house. Come on up, sir. Motion and second, sir. You are properly before us.
Good afternoon, committee, Mr. Chairman. Certainly good to be with y'all today. You caught me with a mint in my mouth. Forgive me. Committee, a few years ago, I passed a bill that basically enshrined in law some rights that parents have and how the local LEA or doctors or other officials, how they need to go through the parent before they do work with the children, whether it's mental health or physical health. We put in that law that if there's an emergency situation that you can immediately take care of a child. One of the things that we've identified since then is that there are times that we see a child could be suicidal. And I want to make sure that that is considered an emergency situation, and therapists and counselors who can identify that have the ability to speak to the child. And that's all this bill does.
Thank you, Mr. Chairman. Any questions for the sponsor? Chairman Terry.
Thank you. Is this specifically only for that emergency type situation? Can you address that?
Chairman.
Thank you, Mr. Chair. Yes, this is specifically for counselors who specialize in suicide.
Any further questions? Not seeing any further discussion. Mr. Clerk, open the vote. All those in favor of House Bill 2459, press aye. All those opposed, no. All members voted. Any member wish to change their vote? Not seeing any. Mr. Clerk, take the vote.
Mr. Chairman, you have 8 ayes and 1 present not voting.
Thank you.
The ayes have it. House Bill 2459 moves on to Health 4. This gets up to item number 15, House Bill 1807 by Representative Parkinson. Motion and second. You are properly before us.
Thank you so much, Mr. Chair and committee. Currently in law, Tennessee law already requires a death certificate for every death in the state. When a case is handled by a county medical examiner, the medical examiner determines the manner of death and files the death certificate. In suspected cases of suicide, current law already requires the medical examiner to consult, sorry guys and ladies, to consult the descendant's treating medical health provider or primary care physician when reasonably identifiable through the family. Current law also includes a full reconsideration and appeal process. If the manner of death is determined to be suicide and the next of kin disagrees, the family may request a meeting with the county medical examiner. The family must receive a written determination addressing their concerns and is notified of the right to seek reconsideration through the Office of the State Medical Examiner and judicial review. Tennessee already has a formal professional peer review reconsideration process for suicide determinations. What this bill does, this legislation, it originated from a constituent case with Senator Lamar. And in that case, a pair of parents wanted an autopsy conducted on their daughter the descendant's spouse did not. And because only the person with the highest statutory priority had standing, the spouse's wishes were controlled and the parents weren't able to request a review or participate meaningfully in the process. And what this bill does, it ensures that a surviving parent is not excluded from that process. And I think Mr. Chair, we have someone that wants to speak on the bill.
Yes, sir. Without objection, we'll go out of session.
Okay.
Oh, yes,
there she is.
1807,
Oh.
Miss Jamie Dickerson, come on up. If you don't mind stating your name for the record, who you're with, and you'll have 3 minutes, ma'am.
Okay, thank you, Chairman. I'm Jamie Dickerson. I am the mother of April Holt. Back in 2023, my daughter was found deceased in her apartment. She was found deceased she had been strangled. She had a bag over her head, tape around her neck. She was found by my 7-year-old grandson in the shower, and his dad had sent him in there to find her in that condition. I knew right away that something was not right. As a mom, my mama gut told me, the Holy Spirit told me, this is not okay. Something's wrong. Everything was saying that all of the investigations were saying she committed suicide. And they continually told me this is suicide. And I said, how could she have put a bag over her head? How could she have taped that? She had very long nails. She would, and I knew that she had already been deceased before that was put over her head. So I had to start doing an investigation of my own to find out what I could do to get justice. I then went and I had to start researching. I knew nothing about the law, nothing about this. This is every parent's worst nightmare. She was 29 years old, a mother of 2 children. And so I found this form that was request of reconsideration of suicide as a manner of death. And that was my first source, is to say, okay, I need to get in there and I need to make sure I get this form submitted in a timely manner so that I could have them reconsider. She had bruises on her neck, her wrists, her ankles. She had cuts on her thighs, and they were saying they saw no signs of foul play. I was there at the hospital with my daughter. I saw the bruises for myself, and they're listed on her medical history reports. They still said she committed suicide. Immediately when I submitted this form, they denied me. They said, I'm sorry, but you are not next of kin. Her husband is. My daughter requested a divorce 2 weeks prior to her death. 2 weeks later, she was gone, and I was no longer considered a person that could even get the documents needed to get this investigation followed through. So I ended up putting this in. They gave it back to me, and they told me there was nothing they can do to help me. This one form held me back. I had to then, for 10 months, leave my son in the hands of a murderer. I had to, for 10 months, fight for my daughter. Knowing that my grandson was still there. It took me 10 months to get a confession myself as my daughter's mom. I got him to confess, a 46-minute FaceTime call. I got a confession. I turned him in. I fought for my grandson, and I have him to this day. I have him and my granddaughter. And I want this form changed so that us parents, when we know something is wrong, that we can go in and we can say, hey, I just want you to reconsider what I know. They never spoke to me ahead of time. They never spoke to anybody. They just made a decision on suicide on somebody they knew nothing about. They didn't know about the divorce or anything of that case. And I just want to make sure that other parents do not have to go through the pain that I have endured. And if this is just one step in that, I am 100% for this bill to be passed.
Thank you, ma'am. That's 3. Greatly appreciate you coming and speaking on behalf. Any questions for the sponsor? Chairman Terry?
Thank you. And I don't know that this is a question so much. I want to thank you for coming up here and testifying. And, as government, we mess stuff up all the time. And there's stuff, half the bills we do up here are cleanup bills or something, because it's an imperfect union, imperfect process. But it's unfortunate, and I can't describe thankful for you to be able to come testify today. But when we have citizens that have unfortunate things occur, but are willing to come up here and speak out and bring forth the injustice that has been there, and then we can get a bill that can prevent, hopefully, something like that from happening to another Tennessean. To me, it's powerful. So thank you for coming up here, and I appreciate all you've done. Thank you.
Thank you.
Any further for the speaker? Thank you again, ma'am. We greatly appreciate you being here.
Thank you.
Without objection, we'll go back in session. Representative, you're recognized.
Serve at the will of the committee, Mr. Chair.
Any questions for the sponsor? Question on the bill has been called. No objection. Mr. Clerk, open the vote. All those in favor of House Bill 1807 as written, press aye. All those opposed, no. All members voted. Any member wish to change their vote? Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 1807 moves on to health full.
Thank you, Mr. Chair, and thank you, committee.
This brings us up to item number 17, House Bill 2413. He's been rolled a week. Never mind. Roll to the, yeah. Seeing Jones either. I'm not seeing number 18, Representative Jones, so we'll roll her. Nope, wait, there she is. You're hidden, right?
I was over there in
That's
the
right.
corner.
Get a motion and second, ma'am, and you have an amendment with this bill, I do believe.
I do. It's 015098.
That is correct. All those in favor say aye. Aye opposed? No. The ayes have it. Amendment is on the bill, ma'am.
Thank you, Mr. Chairman. What this bill does is it seeks to create a Tennessee Board of Professional Sign Language Interpreters and Licensure Program. The licensure would protect deaf Tennesseans' safety and civil rights. The deaf population depend on interpreters in healthcare, mental health, legal settings, education, employment, and emergencies. Without licensures, anyone can claim to be an interpreter, even without the verified skills and ethics training and accountability. This lack of oversight puts this population at risk as far as medical errors and loss of informed consent, legal misinterpretations, and due process violations, educational and employment inequities, and emotional and physiological harm. So I would just ask that we consider the licensure that establishes a clear, uniform standard for interpreter competency across Tennessee. We have some folks here that would like to speak. If that's
Yes, ma'am. Without objection, we'll go out of session. And we do have two individuals. Miss Jade Sims and Kayla.
Amy Lincoln.
What?
Amy Lincoln.
Amy Lang. Oh, yep, sorry, Amy Lang.
Can she move?
Yes, that'd be great. You may come up here. Well, I don't, you might have to go. You might not be able to go around there.
We may not be able to.
Oh, you can come up this way then, right? Yeah, you can come up this way. Up around this way. State your name for the record and you'll each have 3 minutes. So
Okay, thank you. I'll wait till she gets settled in. Good afternoon now. My name is Amy Linkite, and I'm a nationally certified sign language interpreter. I'm also the co-owner of Sign Language Studios that provides ASL interpreters here in Middle Tennessee. And I'm here on behalf of interpreters and agencies in Tennessee. This work is deeply personal to me. I grew up with 2 deaf brothers, and I personally seen the damage that unqualified and unethical interpreters have done in my own family. Those experiences have shaped my career and my commitment to this community. Throughout working in hospitals, courtrooms, and emergency situations, I've seen how unqualified interpreters can change and harm lives. I've seen that because of the lack of accountability that we have in the state. Right now in Tennessee, anyone can call themselves an interpreter. There's no statewide system or consistent accountability that has been set, and that leaves both the interpreters and the deaf community vulnerable. As an agency owner, I can say that most agencies work hard to carefully screen and place qualified interpreters. However, there have been situations here in Middle Tennessee where those standards have not been met, and individuals have been sent to high-risk situations just to fill requests. And when harm occurs, there's no one to bring that to. There's no accountability. Licensure raises the standards for everyone. At its core, this bill is about protecting people. It ensures when communication matters most, like during a diagnosis, a legal decision, or a moment of crisis, the person standing between both languages are qualified, prepared, and accountable. I'm proud to stand here as a sister, as an interpreter, and as an agency owner in support of a system that strengthens access, safety, and trust across Tennessee. Thank you for your time and consideration today.
Yeah, we'll turn this one on. We'll turn that one on. There you go.
Hello, my name is Jade Sims. I'm a deaf advocate here in Tennessee. Also, I was a subject for the Maryland Office of Deaf and Hard of Hearing in Maryland. I did some oversight on the bill and licensure there as well. I also have been a patient advocate in the state of Florida. So just recently, we had a situation happen here in Tennessee. I had a deafblind patient that I was working with, and we were at the urologist, and they had a kidney stone pop up. And the interpreter who was there signed, "It's really small, it's really tiny, no big deal." And that led this deafblind person to believe that, okay, no big deal. So they didn't have any medical intervention or any surgery because of that, because of what the interpreter had said. However, the measurement to have this kind of surgery is supposed to be 6 millimeters or above, requires surgery for a kidney stone removal. Later on, we did not know because, again, the interpreter just said, "Oh, it's small, it's tiny, no big deal." But this deafblind person was in a ton of pain, so we went to the emergency room, and they required an emergency kidney stone removal. During that time, we realized that it was actually 13 millimeters, which is right here, I have it here, which is pretty large. Not small, not tiny, like the interpreter said. That caused his kidney function to diminish down to 20%. 20%. Which was not made clear by the interpreter in that appointment, which caused a lot of misunderstandings and miscommunication. This person is deaf and blind, which means that they have a lot of communication barriers in addition to an unqualified interpreter. And that is a huge risk for their life. For the deaf, deafblind, and hard of hearing community, we ask that you support this bill. Thank you.
Thank you. Any questions for the presenter? Not seeing any. Without objection, we'll go back in session. You're recognized, ma'am.
Yes, just to close up here, we have approximately 500,000 deaf and hard of hearing residents in the state of Tennessee. And I just ask that we make sure that their voices are heard accurately and they receive communication accurately.
Any questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1040, press aye. All those opposed, no. All members voting, remember, wish to change your vote. Not seeing any. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 1040 moves on to health full.
Thank you, Chairman and Committee.
And we're going to go slightly out of order on this one. House Bill 2136, Chairman Terry. Item number 55 on your calendar. Got a motion, I got an amendment on it, motion, amendment, and you do have amendment, I believe.
Drafting code 014073.
That is what I got. Motion second. All those in favor say aye. Aye. Opposed? No. The ayes have it. Amendment as corrected as stated.
Thank you.
You're good to go.
And I appreciate you for taking this up. I do have a bill in another committee that they may be getting to, but my Wednesdays, hopefully with my son finishing his doctorate, my Wednesdays throughout the rest of the month may be in jeopardy. So I appreciate you bringing this up. So what this bill does, I've seen firsthand how the regulatory delays at the federal level can stall patient access to life-changing FDA-approved treatments. And currently, when the FDA approves a new medication and the DEA schedules it, Tennessee law often requires a manual update to our state's controlled substance schedules, and that process can take months and even a full legislative cycle. And so this bill creates a conformity mechanism. So if the DEA schedules an FDA-approved drug other than Schedule 1, Tennessee will adopt that schedule within 30 days unless our state health officials object. So this ensures that the moment a drug is deemed safe and effective by the federal authorities, Tennessee providers can get it to their patients who need it without the unnecessary red tape. So think of this kind of as a consent calendar type of bill, such that if the FDA has gone through that whole process, the DEA has gone through that whole process, they've rescheduled, that it's ready to be for us to have it in our pharmacies. The departments will have the opportunity to kick it off the consent calendar, take it off the consent calendar, and do the process they currently have. If they don't take that process, we can get that to our patients quicker.
Thank you, Chairman. Any questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 2136, press aye. All those opposed, no. All members voted. Any member wish to change their vote? Not seeing any. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 2136 moves on to health full.
Thank you, Chairman and Committee.
I have one more I'm going to take out of order due to the testimony traveling a long way. So House Bill 1694, item number 25. Representative Renaud, I believe you have an amendment. We need a motion and second. You were second. You're properly before us, and you have an amendment, I do believe.
Yes, 14137.
That is right. Motion second on the amendment. All those in favor say aye. Aye. Opposed? No. Ayes have it. You are properly before us, ma'am.
Thank you, Mr. Chairman and Committee. Across our state, canine officers serve on our front lines. They detect explosive, they track suspects, they locate missing children, and they protect our officers. These canines are not pets. They are specially trained public safety assets who enter the most dangerous situations before any human officer. This bill simply allows emergency medical services personnel to stabilize and transport an injured canine officer, but only if no human patient requires care at that time. Human life still does remain a priority. The amendment clearly defines who qualifies as a canine first responder and limits the care to emergency stabilization. It provides good faith, civil and criminal immunity so that EMS personnel can act without fear of disciplinary action. This is not an expansion of veterinary service. EMS may provide emergency care, but not perform surgery or act as veterinarians. There are roughly 10 other states who've already passed similar legislation, so Tennessee will not be breaking new ground on here, but we do hope that we give the most resources to be able to expedite care for our canine officers in the event that they become injured. With that, I stand ready for questions. I believe if we have any technical questions, we have somebody willing to testify.
Fantastic. Any questions for the sponsor or anybody like additional questioning? What? We can go out of session, yeah, if you want to hear the speaker. You don't have any special questions? Oh, one for her. Chairman, you're recognized.
Thank you. Question that I have is, can you bring my office a sign-on form? It's a great bill. Thank you.
Be glad to do that.
Any follow-up questions? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1694, aye, and those opposed, no. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 1694 moves on to health full.
Thank you, Chairman and Committee.
Item number 26, House Bill 0936. Fails without a second. Yes, sir. All right, now that gets us back. Which one are we on now?
We are at 20-0413.
What's number is it? Where are we at? Number 20?
Yes.
She here? Item number 20, House Bill 413. We'll roll her to the hill. Is she? Is she?
That takes us to 24 back to Renault 853.
She's rolled that one too. What's he got?
No amendments, 1944.
Which one?
1944, number 28, Love.
All right, there we go. Item number 28, House Bill 1944, I believe. Representative Love. Get a motion. Second. You are properly before us without amendments.
Yes, sir. Thank you, Mr. Chairman and committee members. House Bill 1944 just would require the department to notify parents who have children who test positive for sickle cell trait.
Any questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1944, press aye. Those opposed, no. The ayes have it. Or take the, it's a long day. Mr. Clerk, take the vote.
Mr. Chairman, you have 9 ayes and 0 nays.
The ayes have it. House Bill 1944 moves on to full committee.
Thank you, Mr. Chairman, committee members.
Lynn's not here. She's rolled. That would be Reeves, 1487.
That brings us up to item number 27, House Bill 1487.
Motion.
Got a motion. Second. You do have an amendment with the bill, I believe.
Yes, sir, I do, Mr. Chair. 14062.
That is correct. We got a motion and a motion on the amendment.
Motion.
Second on the amendment. Motion second. All those in favor say aye. Aye. Oh, no. Opposed. Ayes have it. In this day, man, it's going on. All right, you're here properly before us.
Thank you, Mr. Chairman and members. The original version of this bill raised concerns from grocers and restaurants. We heard those concerns. We stepped back and rewrote the bill completely, and this amendment does that. We didn't want this to be the fish bill that got away. I'm at Bridgestone all month. The current draft is meant to be a very light touch transparency measure, and it says that suppliers need to provide documentation identifying the country of origin of a fish and whether it's farm raised or wild caught, and restaurants must retain that documentation for 90 days or longer if federal law requires it, and they can rely on what the supplier provides. And if a customer asks where a fish comes from, the restaurant must simply answer based on that documentation. The bill also prohibits intentional misrepresentation. For example, claiming an imported fish is local or wild caught without documentation. There are no menu requirements. I want to emphasize that. There are no signage requirements and no reprinting requirements. Restaurants do not have to change their menus under this bill. And I want to state that because a few seconds ago, we all heard that sometimes we mess stuff up, and I want to make sure we get this right, and that is the accurate information on this bill. Consumers increasingly want to know where their food comes from and how it was produced, particularly with fish. Environmental conditions and production practices vary around the world, and fish live in the water that they are harvested from. And consumers understand that environmental factors, particularly with fish, including heavy metals and other contaminants, can differ based on where that seafood is sourced. And I'll just wrap it up by saying this simply ensures that restaurants know where their seafood comes from and can answer a question from a customer who asks. That's all this bill does.
Thank you, Mr. Chairman. Questions for the sponsor Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. So if I don't want to know where my fish came from, all I have to do is not ask. Is that right?
That is exactly correct.
Thank
Yes,
you.
sir.
Thank you, Mr. Chairman.
That's right. That's right. Representative Mitchell, you're recognized. Oh,
It's late.
McKenzie. Yes, sir. Representative McKenzie, you're recognized.
Thank you, Mr. Chair. So yeah, as you know, the folks in the restaurant industry had concerns. So what you're saying, you've worked it out and they're okay with this amended version.
Representative.
I've only received two comments that they're focused on. The first is there is a penalty part of this. I think they would prefer that no penalty exists for not following this law. Of course, I think that means the law doesn't mean much. It's only complaint driven. It does not. It's not a checkbox that the department needs to go and find out anything unless they receive a complaint. Penalties don't stack up under this bill. It's only per complaint. And then the first violation, if there is one, is a written warning. The second thing that they've asked is whether they have to retain that documentation for 90 days. And I've committed that I will go and look at that with the department and see if that's sufficient. And I don't have a full answer on that yet.
Representative McKenzie.
Thank you. Quick follow-up. So, as a person that has a pinky toe in the restaurant business, you get a lot of complaints, and you can get people that theoretically, once this law is passed, actually, go after the business with the complaint. So that's my concern. So does your bill alleviate negligence? I mean, not helpful or erroneous complaints, just mean-spirited complaints. How does it deal with that?
Mr. Representative. Yeah, thank you very much. It basically, well, let me tell you that fiscal review thinks that so few complaints will probably come under this. They put a fiscal note of about $1,000 on it. And I think that's probably accurate. The only penalties come if they're not actually storing documentation or if they are found to intentionally misrepresent what they're serving.
Any additional questions for the sponsor? Yep. Chairman Williams.
I'm not trying to complicate anything, but words matter, I guess. You said seafood earlier. So does the fish have to come from the sea?
That is a fair question. It is seafood, which I think includes freshwater fish as well.
Okay. Thank you. I did not know that.
You did not
Thank
know.
you very much.
Any further questions for the sponsor? Not seeing any. Mr. Clerk, open the vote. All those in favor of House Bill 1487, press aye. All those opposed, no. Mr. Clerk, take the vote.
Mr. Chairman, you have 2 ayes, 6 nays, and 1 present not voting.
The nays have it. Bill
Thanks, committee.
fails. All remaining bills will move to next available calendar. Nope.
1 week.
1 week. Without objection, we are adjourned.